The skill is adult nasotracheal intubation. So first off, BSI, scene safety. I'm going to come up to my patient, knowing that the skill is used for a patient that is conscious and alert. So I'm going to come up to my patient, maybe ask him what's wrong. With him speaking or maybe not speaking, I'll be able to see that I need to place in a definitive airway. So I'm going to assess his breathing rate and adequacy in his chest rise and fall. So I'm going to maybe assess his mouth for any foreign bodies just in case, along with his nares. So I'll tell him about what I'm going to do. So, sir, what's going to happen is I'm going to place this rubber tube in your nose. That way it'll just allow us to ventilate you and allow you to receive the amount of oxygen that you need. And then next, we're going to remove that device and then we'll place in another device to secure it so that way it won't be removed. So going along with that, I will continue my skill. So I'm going to size up the appropriate sized NPA, nasopharyngeal. So I'm going to measure it from his nair. I'm going to lubricate his nair a little bit. Now I'm going to insert the NPA bevel towards the septum and rotate. Okay, now I have that device in place. I'm going to BVM my patient. So if he's conscious enough and alert and he's able to move, I will ask him if he would like to hold the mask to have a good seal on his face. So he's holding a seal to his face right now. While I'm doing that, I'm going to deliver one breath every 5 to 6 seconds. I'm going to go ahead and hook up my capnography to see his correct end tidal move or number. I'm going to also hook up my patient to oxygen, 100% oxygen, at least 85% to pre-oxygenate my patient. So I'm going to continue to pre-oxygenate for at least 3 to 5 minutes before I attempt to intubate my patient through the nair. So while I'm ventilating my patient and he's holding his mask to his face, I'm going to assemble my equipment. I have the correct size ET tube, I have my stethoscope, and I have tape to secure the device to his nair. So I'm going to continue to ventilate my patient. I'm going to give him one more breath and then I will continue the procedure. So, sir, going through this procedure, I'm going to ask you to breathe, allowing the tube to go down into your trachea. So, already, one more breath. Okay, good. So I'm going to remove the mask. I'm going to remove this, alrighty? Tell me if it hurts. Alrighty, so it's removed. So now I'm going to take the ET tube. Alrighty, whenever I insert this, I'm going to ask you to breathe. So breathe for me. Breathe. Perfect. Alrighty, so now whenever it gets past the nares, I'm going to watch the tube go through the vocal cords so that way I know that I have a definitive airway placement. So I'm going to insert the tube. Let me know if that hurts any. Alrighty. Perfect. Breathe. Good. Breathe. Breathe. Okay. So knowing that I have that in place, I saw that it's gone through the vocal cords. I'm going to remove the stylet. I'm going to note the depth as well, and it's at 25. So I'm going to inflate the ET tube device balloon with 10 milliliters of air. Now I'm going to hook the BVM back up. Okay. I'm going to ventilate the patient, continuing one breath every 5 to 6 seconds with 100% oxygen. Still having the capnography hooked up. Now I'm going to have my partner, if I have a partner, to take over ventilations and keeping the device secured to his nair while I listen over his epigastrium and his lung fields. So knowing that my partner is ventilating the patient, breath, breath. Auscultating the epigastrium, breath, breath. Okay, so I did not hear any air movement through the epigastric space, so that means that I did in fact intubate the patient's trachea, so that is a good thing. I'm also noting the depth of the patient's chest rise and fall. Now I'm going to get my tape. We'll say that this is tape. I'm going to secure the tape to the patient's face, so that way I know that if the depth of the ET tube moves, I may or may not be in the trachea if the tube dislodges or goes any further. So I'm going to continue to watch my patient's capnography reading, along with assessing the patient's chest rise and fall, along with the patient's mental status, because I started this skill with the patient conscious. If they become unconscious at any point, I should continue my intubation practices and note their consciousness or unconsciousness. I'll just continue ventilating my patient 1 breath every 5 to 6 seconds with 100% oxygen.